Hi everyone, it's Dr. Zach Borus from Dickinson County Board of Health and Lakes Regional Family Medicine here in Spirit Lake, Iowa. It is the 11th of November, 11/11, and I just wanted to come to you with a few vaccine updates because there have been a lot of questions that we've been getting in terms of who qualifies for what, where to get it, and then questions about safety, etc. So I wanted to give you an update. So biggest thing is that as of last Friday, kids are able to get the Pfizer vaccine between ages 5 and 11. That is a lower dose than for 12 plus. It's 10 micrograms in the vial rather than 30. And that's exciting. So ages 5 to 11 now can be vaccinated. My kids have, a number of other physicians' kids have already, and that's really exciting for those of us who have been waiting for that. With that, there were 3,100 kids in the trial, all who received the vaccine. None of them have had severe side effects. Some did have aches, pains, little fever, sore arm, etc., but nobody had a severe reaction. There is question of whether that myocarditis risk might be there, but in that sample of 3,000 people, they saw none. When there are millions being given, it might be seen, as they saw in some of the older people getting some of the mRNA vaccines. But remember that the risk of myocarditis is far higher if you have COVID than if you get the vaccine. So about 30 times higher, so still safer. The way to get the COVID vaccine for your children 5 to 11 is to call Public Health at 712-339-6050 to schedule an appointment. They're currently doing vaccine clinics with flu vaccine clinics on Tuesdays and Wednesdays. Also here at Lakes Regional Family Medicine, we will have it available in the clinic starting next week. That will be in conjunction with already made appointments. So if your kid is here for a well child check or for another issue, if you want to have them vaccinated at that point, you can start the series. So that's really exciting. We're happy to be able to offer that service. The reason it matters is that, while little kids are less likely to get severely ill, thankfully, from COVID, still more than 8,000 kids have been hospitalized from COVID. Nearly 100 have died, and sometimes those hospitalizations are quite significant. So to protect them and to protect everybody around them and who they come into contact with, we certainly recommend the vaccine. Otherwise, the availability of the Pfizer 12 plus vaccine, as well as the Moderna vaccine and the Johnson & Johnson vaccine, those have changed too. So I just wanted to give you an update on that. So here in the clinic and at Public Health, there is the availability of first or second dose of Pfizer or Moderna, and you can call the same ways that we were just talking about. So if you're looking to start your vaccination series and want to do it with us, we sure can accommodate that with either Moderna or Pfizer. That's what we have in stock. Still very much recommended, still proving to be far, far, far safer than not getting vaccinated. We still have 5 people in the hospital right now with COVID, and it's just continuing. So I encourage everybody, if you have not gotten vaccinated, to please do so. Again, mandates are way above my pay grade. I'm not going there, but I strongly encourage you to get vaccinated, both for your safety and for that of the community. So Pfizer is available here, Moderna is available here. Outside in the community, Hy-Vee, both in Spirit Lake and Milford, has the Pfizer vaccine for 12 plus, so that's the higher dose one than the kids, and you can go on their website or give them a call and set up an appointment. The Moderna is available at both Lewis Drug and at Walmart. So they both have that one. You can call them or go to their websites and sign up for vaccine appointments for those. And then Johnson & Johnson is also available at Lewis Drug as well. So if you're looking for the one and done, though it's now going to be a 2 and done series, it appears, then you can do that at Lewis Drug. Also, Lewis Drug also has Pfizer, so they actually have all 3. So you can pick and choose. That also comes into play when we're talking about boosters. So we've been getting a lot of questions about boosters, who should get them, when, etc. So as of a few weeks ago, the FDA and CDC recommended boosters for people who are at higher risk of getting severe illness from COVID, or those who are at higher risk of getting COVID based on where they live or where they work. So that would be people 65 plus who have had both of the initial shots 6 months in advance, or people who are under 65 who have, because of where they live or work, or because of medical conditions including smoking, high blood pressure, BMI over 25, so being overweight or slightly overweight. All of those things put you at higher risk. Also depression and other mental illnesses do qualify you now too. So really, they're recommending for most adults, because unfortunately many of us qualify as those things, to get a booster. So those are available at the same place. We are doing them here in terms of Johnson & Johnson and Moderna, which is a half dose of the Moderna, Pfizer and Moderna. Same dose as the first 2 shots of Pfizer, half dose of the Moderna versus the first 2 doses. And then Johnson & Johnson, you can get actually 2 months after your first dose of that. And again, that's available at Lewis Drug, as are Moderna and Pfizer. Moderna and Pfizer are both available at Walmart, and Pfizer is available at Hy-Vee. So again, these are very safe vaccines. There has been a lot of talk about them causing major illness. It does not. There could be rare side effects. There can be that myocarditis or heart inflammation risk, especially in younger men with the Moderna vaccine. That's sort of when we've seen it. So if you feel more comfortable with something else, get something else. We just want you to be vaccinated and protected. We are recommending that people who have had COVID in the past still get their shots. Actually, there's some excellent new studies showing that people who have had COVID and then get the 2 mRNA vaccines, so Pfizer and Moderna, they have the superhuman immunity where they would probably be able to kill SARS or other coronaviruses if they came into contact with them. So that's pretty cool, and it seems to be long-lived. The blood clot risk with Johnson & Johnson, far less than with COVID. The myocarditis risk, far less than with COVID. So yeah, you might get a little ill. It's true. You might not feel good for a couple days. Plan it for a day when you probably aren't working the next day, but again, go ahead and get it for you and for our community. Please keep everybody safe, and hopefully this is helpful. Again, the number for public health is 339-6050, and they can get people scheduled for their first doses, whether now 5 through however old folks get, and the pharmacies have them as well for people 12 and over. So thanks for your time. Have a great day.